Welcome to the Omni Dental Podcast. Imagine paying for car insurance every single month, but the second you get into a major accident, they write you a check for $1,000, wish you luck, and basically leave you to pay the other 15,000 out of pocket.
Yeah, which sounds like a complete scam.
Right. It sounds terrible.
Yep.
But unfortunately, that is a pretty accurate description of how your dental insurance actually works.
It really is.
Yeah.
I mean, it completely shatters the baseline expectation that you, as a consumer, have when you hear the word insurance.
Exactly.
People think of this, grand safety net.
Yeah.
But what they're actually buying is structurally an entirely different thing.
And that is exactly what we are tackling today. For this deep dive, our mission for you, the listener, is to decode this notoriously confusing world of dental plans. Specifically, we want to answer the big question, is dental insurance actually worth the money, or are you better off just paying out of pocket?
It's the question everyone has, honestly.
It really is. So to figure this out, we're pulling insights from a super detailed July 2026 breakdown from the Omni Dental blog on the true costs of dental insurance. And we're also going to look at Omni Dental, they're located in Arlington Heights, Illinois, as a sort of practical case study.
Right, to see how a modern patient-focused clinic actually navigates all this messy financial stuff for their patients, right?
Exactly. Plus, a look at how they approach patient care and even aesthetics, which is wild. But where do we even begin with the insurance stuff?
Well, the best place to start is by just addressing a fundamental cognitive trap, honestly. Most people treat dental insurance exactly like they treat health insurance.
Oh, for sure. I mean, they're usually bundled together in the HR packet, right?
Exactly. So people assume the underlying math, the actuarial science, is identical. And that assumption is the very first mistake.
Wow.
Yeah, and it's the one that ultimately costs people the most money.
Okay, let's unpack this. Because before we can decide if it's worth it, we have to understand what it actually is. You're saying the word insurance is just misleading here.
Completely. I mean, think about health insurance. The structural intent there is to protect you from catastrophic, completely unpredictable events.
Like an emergency surgery or something.
Right, like a sudden appendectomy. Or if you develop a severe chronic illness. Health insurance is designed so that the sicker you get and the higher your bills climb, the more the insurance steps in to help.
Oh, right. You eventually hit that out-of-pocket maximum, and then the insurance company takes over 100% of the risk.
Exactly. But dental insurance operates on the exact opposite model. It's not catastrophic at all. It is designed almost entirely for everyday, highly predictable maintenance.
Interesting. So to really grasp the mechanics of this, I think we need to walk you through the 4 pillars of a dental plan, because these terms get thrown around all the time, but seeing how they work together is key.
Yeah, let's break them down.
So first, you have the premiums. This is just your monthly fee, right? The ticket price to play the game.
Right, just a subscription cost.
And then second, you have the deductibles. And the source notes, this is usually a relatively small amount, like maybe $25 to $75.
Yeah, usually pretty low. It's the amount you have to pay out of your own pocket before the coverage even wakes up and decides to contribute anything.
Got it. And then pillar 3?
That would be coinsurance. Once you clear that deductible, you enter this percentage split.
The famous 80-20 split or whatever.
Exactly. So it means you are still on the hook for, say, 20 to 50% of the procedure's cost. So even when a procedure is technically covered, you are still paying a really significant chunk of that bill.
So dental insurance isn't a safety net for a disaster. It's more like a prepaid maintenance plan for your car, like a subscription box for oil changes and tire rotations.
That is exactly what it is. And what's fascinating here is how the 4th pillar, the annual maximum, completely flips the concept of insurance on its head.
Wait, how so?
Well, the standard annual maximum is usually just $1,000 to $2,000 for the whole year.
That is not a lot of money in the dental world.
Not at all. So unlike medical insurance, which covers more as your bills get higher, dental insurance literally stops paying right when you need it most.
Oh, wow.
Yeah, once you hit that low cap of, say, $1,500, the insurance company completely washes its hands of your care. You are paying 100% out of pocket for the rest of the calendar year.
Man, that is brutal. So since we know this acts basically as a maintenance plan, let's run the actual math to see if this subscription is mathematically in your favor.
Let's do it.
Looking at the baseline math from the sources, an average individual dental plan costs about $30 a month. So that's $360 a year.
Right.
Now, if you don't have insurance and you just pay cash for 2 routine checkups and cleanings a year, that's going to run you somewhere between $400 and
And
$500.
the math right there reveals the big win scenario for the patient.
Because the care costs more than the premiums.
Exactly. Almost all standard plans cover routine, preventative care at basically 100%. So if you go twice a year, the plan literally pays for itself.
Yeah, you put in $360, you got $500 in value back.
Right. And even if you just need like one basic filling, which runs anywhere from $140 to $500 out of pocket, the plan usually covers 50 to 80% of that. So you are coming out ahead if your needs are just basic and consistent.
But wait, hold on. If the insurance company is consistently losing money on the people who actually get their cleanings, isn't their entire business model relying on people paying that $30 premium and then just forgetting to go to the dentist?
Oh, absolutely.
I mean, that sounds identical to a gym membership. Like, the gym only turns a profit because half the people paying never actually show up to use the treadmills.
Yeah, and this raises an important question about the whole industry. The true value of the plan is tied entirely to your personal habits.
So it's basically a behavioral tax.
Exactly. The insurance companies rely on the reality that a massive percentage of people will pay the premiums just for the psychological security of having coverage, and then they'll get busy and completely skip their appointments.
So the people who stay home are literally subsidizing the people who go get their teeth cleaned.
Yep. If every single person with dental insurance actually used all their preventative benefits, the whole system would go bankrupt.
That is wild. Okay, so the math undeniably looks great for a routine cleaning, but we have to look at the catch here. What happens when you wake up in agony on a Tuesday and you suddenly need major work?
This is where the standard insurance model just totally falls apart.
Because of the costs, right?
Right. Let's look at the reality of major procedures. A root canal, for instance. Without insurance, that's going to cost you between $700 and $2,100.
Ouch.
And it gets worse, because after a root canal, the tooth becomes brittle, which means you almost always need a crown on top of it. A crown is another $1,100 to $2,500.
So in a worst-case scenario, you're looking at over $4,000 just to save one single tooth.
Yes. And now, let's apply the insurance logic to that $4,000.
Okay.
Your plan might say it covers major procedures at 50%, which sounds fantastic. 50% of $4,000 is $2,000.
Right. That sounds like a huge help.
But you have to factor in that annual maximum. If your cap is only $1,000, they aren't paying $2,000. They pay $1,000, and you are immediately on the hook for the remaining $3,000.
Wow. So if you need, say, 2 root canals in a year, you are completely maxed out on the very first tooth.
Exactly. You blow past the cap instantly.
Here's where it gets really interesting, though, because even if you haven't hit that annual maximum yet, the source points out they still might refuse to pay a single dime for that crown.
Yes. The waiting periods.
Yes, because hidden deep in the fine print, these plans can actually force you to wait 6 to 12 months after you enroll before they will cover anything major like a crown or a root canal.
Right. And actuaries actually call this protection against adverse selection.
Adverse selection.
Yeah, because unlike a sudden heart attack, tooth decay is a slow process. Insurance companies know that without waiting periods, you could just walk around with no insurance, feel a massive cavity, sign up for a $30 plan, get a $2,000 surgery the next week, and then cancel the plan.
Okay, so it stops, like hit-and-run enrollment.
Precisely.
But man, if you've been paying your premiums perfectly on time and you just happen to break a tooth by biting a popcorn kernel in month 3, you are paying for the entire fix yourself. It feels so punitive.
It definitely does, and that's not even mentioning the flat-out exclusions.
Right, like cosmetic stuff.
Yeah, teeth whitening, veneers, those are almost universally excluded. The insurance views them as elective, and orthodontics, like braces, they usually sit in a totally separate category with their own strict lifetime cap.
So basically, if you need significant reconstructive work, the traditional insurance model is just a bad deal.
It really is. It just doesn't serve the clinical needs of those patients.
Which brings us to the alternative highlighted in our source material, which is dental savings plans.
Yes, a completely different model.
Right, so instead of paying premiums for these weird coverage percentages and dealing with caps, you just pay a flat annual membership fee. And in return, you get heavily discounted rates at participating dentists.
And this is actually why personal finance experts like Sue Zorman publicly favor these savings plans over traditional individual insurance.
Really? Suze Orman is endorsing these?
Yeah, because they completely eliminate the two biggest financial traps.
Yeah.
There are zero annual spending caps, so you never have to worry about maxing out your benefits if you need multiple crowns.
Oh, that's huge.
And second, zero waiting periods. You can literally sign up on a Monday and get a heavily discounted surgery on a Tuesday.
So it's basically a Costco card for your teeth.
Haha, yes, exactly.
You pay the membership fee to get in the door, and then you just get the wholesale pricing. Nobody at Costco is going to tap you on the shoulder in November and say, excuse me, you bought too many paper towels this year. We're cutting you off.
Right, you just keep getting the discount. But if we connect this to the bigger picture, it is vital to remember that neither option is universally better for everyone.
Right, it totally depends on your situation.
Exactly. If you just need predictable, routine maintenance, traditional insurance, especially if your employer is paying for part of it, is a great tool. But if you have a history of complex dental issues, the caps and wait times make a savings plan a vastly smarter move.
And dentists actually prefer the savings plans too, right?
Oh, absolutely. It eliminates the administrative bloat, the claims denials, all those months-long delays just trying to get paid by the insurance giants.
Yeah, that makes sense. And that financial burden is actually driving a big shift in how people choose their providers now. When you are managing your own dental budget like this, you can't afford to bounce around from a general dentist to a periodontist and an oral surgeon.
No, the separate consultation fees alone would eat up your budget.
Exactly. You need a highly efficient all-in-one clinic, and that is exactly where Omni Dental in Arlington Heights comes in.
Yeah, they really represent the modern evolution of clinical dentistry.
Because they actually sit down and help you navigate the money side before they even touch your teeth.
Yes, they actively review your specific coverage, they calculate your remaining maximums, and they estimate your out-of-pocket costs down to the exact dollar. They completely remove that financial ambush.
Which is amazing. But of course, the administrative transparency only matters if the clinical skills are there to back it up.
Very true.
And the sources detail the credentials of Dr. Bylis Poles at Omni Dental. He has over a decade of experience, and his specialty is handling exactly those complex multi-stage procedures that destroy insurance caps.
That's right. We're talking about advanced prosthodontics, complex root canals, and especially dental implants.
Implants are intense. Yeah.
Very. Dr. Poles handles all-on-4 implants and full-arch restorations, which is basically replacing an entire arch of failing teeth with a fixed implant-supported bridge. And he even performs the complex bone grafting that's often required for patients who have significant bone loss. When you are undergoing a surgery of that magnitude, you desperately need a provider who intimately understands both the surgical complexity and the fact that you are probably stretching the absolute limits of your financial coverage.
So what does this all mean? Well, it means Omni Dental operates as a major regional hub. They aren't just a neighborhood clinic for Arlington Heights.
No, people travel for that level of care.
Yeah, they are pulling in patients from Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, DePlain, and Elk Grove Village.
It's a massive coverage area.
It really is.
Yeah.
But here's the part of the source material that really threw me. They're actually bridging the gap between dental health and overall aesthetic wellness.
Yes, this is such a fascinating trend. Alongside traditional dentistry, the cleanings, Invisalign, Smile Makeovers, Omni Dental has integrated a whole suite of aesthetic services.
Wait, hold on. Let me just list what the sources say, because it's crazy. Botox, fillers, Sculptra, IV drip therapy, laser hair removal, microblading, and body sculpting at a dental office.
It is a lot, yeah.
I mean, I have to admit, that sounds a bit concerning to me. Isn't there a risk of a medical practice losing its focus if they're doing root canals in room A and laser hair removal in room B?
I know it sounds counterintuitive at first, but when you look at the physiology and the patient experience, it actually makes perfect sense.
Really? How so?
Well, let's take Botox. Most people just think of it for wrinkles. Right?
For anti-aging.
But dentists use Botox therapeutically in the masseter muscles to stop severe bruxism, which is chronic teeth grinding.
Oh, I grind my teeth all the time.
And if you don't treat that, you will literally crack those $2,000 crowns we just talked about.
Oh, wow.
So by treating the facial muscles, they are actively protecting the dental investment.
Okay, that actually makes absolute clinical sense. But what about like IV drip therapy? How does that fit into an oral surgery clinic?
Think about the physiological stress of an all-on-4 implant surgery. You're sitting in a chair for hours, undergoing significant trauma to your jawbone.
Yeah, sounds exhausting.
By administering targeted 5V drip therapy with high doses of vitamins, minerals, and hydration right there during or after the procedure, they proactively manage your systemic stress response.
Interesting.
It reduces inflammation, supports the immune system, and drastically accelerates the healing of those bone grafts.
When you break it down like that, the logic is totally clear. I mean, dentists spend their whole academic career studying the intricate anatomy of the face and neck anyway.
Exactly. They know the cranial nerves, the musculature. They're arguably more qualified to administer facial aesthetic treatments than almost any other medical professional out there.
Makes total sense.
It really reflects this modern, patient-centered philosophy. Omnidental recognizes that how you feel about your smile is psychologically connected to how you feel about your overall facial aesthetics and vitality. They are treating the whole human being, not just a set of molars with a billing code.
I love that. So to wrap up this deep dive for you, let's distill the core takeaways. If you are trying to figure out if your dental insurance is worth it, first, check your annual maximum so you know exactly where your ceiling is.
Absolutely essential.
Second, never just assume a major procedure is covered. Ask the hard questions about waiting periods. And third, remember that for basic preventative care, insurance is usually a win.
And I'd add that if you were in the Arlington Heights area or any of those surrounding communities and you're feeling overwhelmed by these low-cap plans, or if you just need relief from tooth pain, you should really reach out to OmniDental.
Definitely. You can call them at 847-483-8833. Again, that's 847-483-8833. Don't wait until you're in agony to figure out what your plan actually covers.
And as we close out today, I want to leave you with a final thought to mull over. We just saw how practices like OmniDental are evolving to treat the whole patient, integrating complex prosthodontics with things like IV therapy and facial aesthetics.
Right.
Yet traditional dental insurance is still stubbornly trapped in this rigid, low-cap model from the 1970s. So will the big insurance companies eventually be forced to evolve and cover this whole-body approach to wellness? Or will these all-inclusive, membership-based holistic clinics just bypass the insurance industry entirely and become the new standard?
Man, that is a massive question for the future of healthcare. Well, thanks for joining us on this deep dive, and we'll catch you next time.